Hello, I'm Dr. Greer from Veterinary Village and Check Out Vet. Today, I'd like to help you better understand cat vaccinations. Judy will be helping by asking some questions about it, and I hope we're able to help you understand more about why cat vaccinations are so important.
So, Dr. Greer, what exactly are cat vaccinations?
Cat vaccines are either a killed or a modified live version of a virus or bacteria that's given as an injection. These injections help the cat's own immune system develop protection against those specific diseases, such as rabies or feline leukemia. Without a doubt, vaccines are one of the most important medical breakthroughs in human and animal health.
And are cat vaccinations necessary?
Yes, even if your cat's entirely indoors, yes, it's still necessary.
And then what cat vaccinations are typically recommended and what are they for?
Sure. So FVRCP is kind of a mouthful. It's feline viral rhinotracheitis, calicivirus, and panleukopenia. No one can say that, so why we always say FVRCP. So the viral rhino and calici are to protect your cats against upper respiratory infections, and panleukopenia is the cat version of dog parvovirus. That virus is very dangerous for kittens, often causing sudden or rapid death. Rabies, of course, is for human health. That's to protect our household pets from bringing any kind of rabies into our life. So if they've been out mousing or they played with a bat in your house, we want to make sure that they don't end up with rabies causing you an exposure. FELV is leukemia. That can cause blood disorders such as anemia, an inability to fight infections, and in some cases, tumors. Now, FIP is feline infectious peritonitis. We no longer have a vaccine for that. We did at one time, and we no longer have an FIV, feline immunosuppressive virus vaccine. So for those, we can't vaccinate, but we can help our pets to be protected by other mechanisms.
Okay. And what is the vaccination schedule for kittens, adult cats, and senior cats?
Sure. So typically kittens get two vaccinations, one at around 8 weeks and one at about 12 weeks. That will include the FERCP. That'll include feline leukemia, which is recommended for all kittens, not just kittens that are outside or from farms. And then rabies. In most cases, we want to do vaccination for rabies as well for our cats. Even though they may not be outside much, we can still see exposure to rabies. So it's important that we're doing that. It is not required in cats like it is in dogs in some municipalities, but it is in others. So you need to know what your local ordinances say about rabies for cats.
Okay. How about, and then are there any risks or side effects associated with cat vaccinations?
And there are, but they are pretty rare. If there is a reaction, it's usually just amounting to a day that they're kind of quiet, don't eat very much, maybe run a mild fever, and then by the next day they bounce right back. So cats recover very quickly from their vaccinations.
Okay. And if my cat is going to strictly live indoors, do they still need to be vaccinated?
Yes, like I said before, bats can end up in your home. Cats can sneak out, even though you don't think that they will. They come sometimes get through the door, and cats can meet other cats through the screen door of your porch or the window of your bedroom. So there are definitely exposures, even if your cat is exclusively indoors.
And then why is it important to avoid missing a cat vaccination?
Well, a lapse in protection can lead to a serious infection. If it's rabies and there's an exposure, you may end up with your cat in quarantine. So it's very important that we keep our pets up to date, our cats up to date on other vaccinations for their protection and for ours. So if you have any questions regarding cat vaccinations, give us a call. We're always here for you.
Awesome. Thank you so much.